Hi, Dr. Wu. How are you?
Good, thank you. Hi, Julie.
Hi, good to see you again. And thanks for taking the time to talk with us today. And today we're going to talk about high blood pressure and why this is one of the leading diseases in our country today. So, why is it, Dr. Wu, that there's so much high blood pressure in our society?
The high blood pressure is going up
Mhm.
because two reasons. One is the fast-paced stress, mind anxiety, and second is because the food is a problem too. The food is all this is like fast food, master produced. Number one food problem is the dairy. People drink milk and cheese.
Oh, dairy is the number one
That,
cause.
yeah, is it because like slow down
Hmm.
weaken the energy, and plus when people eat like cheese and drink a lot of milk,
Yes.
their blood is like becomes too sticky like honey.
Oh, really? So
That's called
dairy.
excessive young
Mhm.
energy. It's like make it like excessive too much. Too much that means too much sticky.
And then because of that, are you saying the blood is sticky?
Yeah. Like
Oh,
look,
wow.
blood normally when you're younger, your blood is like it's like tea or water,
Right.
hydrate.
It's flowing.
It's flowing and make it
Right.
put the tea in the water, it make it a color like a black. See, this it hydrate like water, right? Move,
Right.
and this is like honey, like sticky.
Wow.
That's why the heart have to pump when the heart have to press
Hmm.
uh, to make it flow. But it's difficult. That's why you have to work harder, work harder. That's why blood pressure go up. But you have to go to a root cause instead of treat symptom. If you
Right.
know. But root cause you have in order to that's the root cause too much something you have to cut down the meat, cut down the number one problem is cheese and dairy. Number two is too much meat too.
Oh, wow. Yeah,
The
that's
meat
a
quality is no good. The meat is a master producer too.
interesting. So if you change your diet, that will lower your blood pressure immediately, just changing
It's
your what you
for
eat.
one type of in Chinese medicine for excessive type of blood pressure problem
Right.
because much garbage in the system.
Mm.
Need to cut down intake garbage and it have to be better quality food and less garbage.
What are some of the symptoms of hypertension?
The symptom that mean uh, they can be feel headache and dizziness.
Right,
Uh,
dizziness. Hmm.
Also, some of the hypertension is no symptom. That means it's more dangerous because
It,
their blood pressure go up because the patient doesn't know their problem. That means need to go to the doctor to check it, or they have to check themselves.
mhm.
Go to the like pharmacies. They have machine there, check their blood pressure. Otherwise, they don't know.
Mm.
Also, some of the high blood pressure is from uh, other disease. Like example can be like not even not often, but sometimes it happens because some of them from the tumor. The tumor somewhere like interfere with the artery, and they because it's gets stuck somewhere, then the blood pressure go up. Like some people they go to pee, go to bathroom. The bladder have tumor or whatever. They go to every time go want to go to urinal, then their blood pressure go up sky high. It's very dangerous too.
Mm.
But
So
that they have to see the oncologist to get diagnosed. Have to
right.
look for see what's problem instead of treat symptom, because can be like 60% is from over eat too much meat and eat too much cheese, and 1% might is from other problem, maybe from tumor or something else cause that. And some of the problem just weak, older people, older is weaker, like spleen and kidney, young energy very low, They are
Right.
weaker, they cannot pump. But the main problem still is the stress in diet. They eat too much something.
Mm-hmm.
That's the main problem. But when they're younger, they can process. They don't have problem with this. And when they get hit the age 50, they become to realize their problem because they're not so strong no more.
So what would you suggest someone that has symptoms of high blood pressure? Should they start changing their diet and nutrition, do qigong, tai chi, emotionally de-stress? I mean, will all that help them?
Number one, the best for the patient is I tell them try to take a walk for 1 hour, at least 1 hour, take a walk either morning or evening,
Right.
1 hour. And then for that, I tell them to just try cut down the meat. If they need eat meat, only need 1 hour a day. That means either eat one time a week. If they can eat 7 or 8 hours one time a week. If you eat every day meat, only eat 1 hour a day. But even American doctor, they recommend their patients say only 2 hours, but I recommend only 1 hour because
One
big,
ounce.
yeah, 1 hour. Because you big guy, you might eat
Yeah.
2 hours. Okay, but like onto people be small size, just need 1 hour.
One
1 hour
ounce of meat per week.
a day.
Oh, 1 ounce per day. Got it.
Day.
Okay.
But if you eat 8 hours a week, okay. But the people eat 8 hours every day, way too much. Then I recommend say 100% no cheese, no milk, and they get better. Take a walk 1 hour. Second is get rid of cheese. 100% no cheese, no dairy, even no yogurt either. Because yogurt and any dairy can make the blood get sticky like the honey. Then she like the heart want to pump.
Yeah.
Have to pump so hard, the blood pressure go up that way. But if you stop one, cut down on meat and stop on cheese,
Yeah.
see the hot water is hydrate. The artery, see,
Right. It's fluid. Mm-hmm.
oh, easy, right?
Yes.
Right now, you change the like sticky block in the artery to the hydrate like water here. This
Right.
make it easier. And one
Yes.
thing they can do, charge the battery, breathe in, is to tone for the chi, get stronger. Walk because they stress. You can be stressed and take a walk 1 hour, but of course, qigong and tai chi the best. But if they don't have a class or teacher for go to, just right away take a walk. They don't have to go to any class. That's the two thing. First thing is take a walk 1 hour. Second thing is 100% no dairy and cut down the meat. And third thing they can do is drink tea, like either called Kuding tea, Kuding. Is another tea I use is called Pure tea with orange peel or with orange peel called Chen Pure tea. CHENPI. Chen is the Chinese name for the tangerine. Peel. Peel is the skin. And Pure tea is PEP. Pure is PUER. Pure tea. And another tea can be used called white tea. WHITE.
Right.
White.
Right.
Those couple kind of tea they can drink, but also another diet can put in is they want to blood pressure very high to 200, very dangerous, or 180, very dangerous. If you drink beet juice and celery juice, celery juice, BEET,
Beet
right?
juice. Uh-huh.
Yeah, beet juice even is only need 8 ounces a day. Can a lot of people try it bring down the blood pressure already.
Right.
If they have too energy, young energy too high, they can cool down, bring down the young energy. For like most people, they try it because this kind of food is nothing dangerous.
Right.
You drink tea, what tea, pure tea, or you drink the juice, nothing dangerous. But it then, because a lot of times, sometimes they see doctors take a prescription or go emergency room 8 hours or overnight. They still not went the drug not went up down because they're so stressed out. And they before that kind of case, even they try to join the truth. They know it will help them more. Why not something that they can do themselves at home? They can take care of themselves.
Right.
But about 10 to 20%, either China or US, probably between 10 to 20% of high blood pressure, even prescription not helping either.
Right.
Now, then they have to figure it out themselves because very dangerous. If they hide, I know one guy just left today. He just hang out with me, to say hi to me every day. Then blood pressure very stable. He because of stress, because he doing investment with the stock market every morning. He gets so stressed out with the number.
So, Dr. Wu, you mentioned that some people have very high blood pressure when they see that doctor in the white coat. You call it the white coat syndrome. So, what is that about?
Yeah, because when they see the white coat, that means they go to a doctor office, they get nervous because
Right.
whatever the doctor address is because very professional, they get nervous. You know, it's white coat symptom can be white coat high blood pressure, white coat high blood sugar, any symptom that's from the nervousness. It's because nervous. When you're nervous, the blood pressure go up very high. And that's not real problem because they go home. Actually, they check again, it's normal. But
Yeah.
some people, even they don't see the white coat, they just look at the machine
Right.
and their number go up. But I use a book, block their eyes, and I say use my eyes, look at the number, and number go down. That means
Right.
problem not real. If you they recognize that not real, they have to train themselves to relax. Like
Right.
this guy up here, his blood pressure 280 and go emergency room, cannot bring it down. And come here, hang out for a couple of hours. I just relax him and I use my eyes to look at the machine and keep going down from 220 down to like 135.
Yeah,
That
that's
means you recognize
yeah.
that's the he's just like so nervous.
Yeah, that's a very real situation. I mean, I'm guilty of that too. I think people are just very scared of going to see the doctor because they think something's wrong. So that makes total sense about the white coat syndrome. Dr. Wu, what do you think is the Western medicine approach versus the Eastern medicine approach to high blood pressure? How would you treat a patient with high blood pressure versus a Western medicine doctor?
Yeah, the Chinese medicine is from the ancient philosophy, Taoism philosophy, because I have to be change the lifestyle, and also the patient have to be do some kind of practice like meditation, Tai Chi, Qigong, and involved to change their lifestyle. That's what Chinese medicine. But for the patient, they don't want to change their lifestyle. I ask them, you have 1 hour to take a walk or relax meditation. They have no time. I send them to Western doctor because you go to Western doctor, they don't teach you doing that. And you should
Right.
take the symptom because your blood pressure high is dangerous, but you need to bring it down.
Mhm.
But it's you know it your problem from overstress yourself. You have to want to learn only design. Different is Chinese medicine design. That's for patients they want to take time for themselves and make
Mhm.
change their life and lifestyle. Then they can come this way. But the problem is like some people they don't want to do anything. That's why even Chinese medicine or no one can help them. That's why they have to take a pill forever. But I say I respect people have their own belief system. They believe their job and money. They make more money and want to be number one
Mhm.
because they compete. Want to be
Yeah.
number one.
Yeah.
They have their task to the gold medal. Gold medal can be a goal. Can be value. Can be garbage too. Garbage you stress out and attach to a gold medal. That's why I stress.
Mm.
And I rather step down. I don't have to be number one, but it's
Right.
their belief system, not mine. But I research people have different belief. If people believe they need to work so hard like that, they believe they have to go through that in their life. That's their belief because I don't need it. But you
Right.
want to heal or become a president, you help the whole country, then you have to stress out. Or you want to be a prime minister, the whole day you work for the empire is a stress too.
Right. No, I
But that's their job.
completely
Now my job is your belief system. So everyone should be different, but that's why we have two way, east and
right.
west, right? Which way you want to go? Go this way, this way. I respect people. They
Yeah.
have to, at least we have to advocate people if they want to make some change, and then they come this way. They want to make some change. They go to the insurance doctor, like modern medicine. They get them a pill and treat them forever.
Right.
Treat.
So I know I completely understand everything that you're saying. I mean, it just seems to be a major challenge and difficulty because modern society is very competitive. Everyone's trying to survive and pay their bills, so they're constantly running all the time. So what would you say to someone that is on prescription of of high blood pressure for years? Are you saying that someone that's on prescription for years, they must take lifestyle action and change that before starting any treatment? Because
Yes, they have to change their lifestyle first, and then they change their lifestyle for a year or two. Then their doctor might can get monitor them to get up the medication slowly, because for safety reason they have to let their doctor know what they want to do. And normally doctors busy, they see 50 patients a day. Even in the hospital nutrition, they see 50 patients a day too. They only have 10 minutes, 15 minutes a patient. They don't have enough time to figure out what do they need.
right,
But then that's why uh, the patient have to learn and figure out themselves. And they have to talk to their doctor, say they want to change their lifestyle, change the diet and do some exercise. Some doctor even recommend their patient do Tai Chi and Qigong too. Right now, a lot of doctor they send their patient to my Tai Chi Qigong class.
right.
In my office building here, we have 40 office building. We have many doctor in uh, psychotherapy in this building too.
Mm-hmm. Dr. Wu, do you see high blood pressure as a disease?
No, it's a symptom. It's the disease is the under the symptom. And the disease is type of pressure can be caused from different kind of disease too. Not not just disease, just a symptom.
Right. Yeah, I figured you would see it differently from a Western medicine doctor. It's just really interesting because you speak a lot about finding the root cause of every disease. And once you address the root cause and take the little actions to change that, then that disease literally disappears and it just literally disappears on its own. So with people with high blood pressure, if you just take these few actions of eliminating gluten and dairy and meat, not totally eliminating meat, but in small doses, exercising, having movement, tai chi, qigong, reducing your everyday stress, that in itself will lower your it will lower your blood pressure already.
Yes. Yeah,
Mm,
even just like early state, like minor high blood pressure. They what we minor beginning there, you see the blood pressure from 110 to 120, 120 to 25, they might go up to 30. That's beginning. They rise up a little bit. Then if you change your diet, then you don't have to be
right.
like wait until you get worse and you need prescription.
Yeah. Yeah, I mean, it sounds like it doesn't sound like they're monumental changes. It's not like you have to go to surgery or anything. So it seems very profound that these simple actions will change the chemistry of your body that quickly. Um, what do you suggest to someone that is that likes cheese very much, especially in the American, diet and food? There's cheese in almost everything.
Yeah, for me it's no problem. I grew up in
Yeah,
and
but
have
for
cheese or
the
milk.
average American, they eat a lot of cheese. It's in
But
everything. thing
And
almost.
every time their blood pressure come down normal for 6 months, a year, and they eat cheese. And the next day, their wife called me. They say, "Oh, my husband have high blood pressure again. I don't know what happened." The wife say, "I don't want my husband go back to take the drug again."
Right.
And make appointment to see me. I video the husband say, "Tell me what you cheating, what do you eat? Tell me." Your wife gets so scared. He tell me, say, "I eat cheese, cheating." And I
Every
say,
day?
no, cheating one time only. The blood pressure go up already. I
Oh my
video the
gosh.
guy, and I tell the guy, now I have to send your video to your wife. Your wife keep worry about you, but
Yeah.
they don't at home. They don't talk to each other. They bring to here. They bring the husband to here. The husband eat cheese outside the home.
Oh my
Not home.
goodness. Yeah. That's
Now at least we know what is the problem, because
Mhm.
you know no cheese for a year and blood pressure all good. Then suddenly he just explained himself he cheating. It's good to cheating sometimes, and keep an eyes on yourself. You know,
Right.
uh, what is the problem. But you
Right.
eat cheese every day all your life, you don't know what's problem.
Right.
Now 1 year no cheese, and he cheating, and the blood pressure go up. That's not only one time, 3 times already. I have so many patients, they feedback. That's how I learn. I learn from
Right.
my patients because I listen to them, what they eat and what happened with them. And
Hmm.
they tell me what's going on. I listen. That's how I learn things. This is not
So,
only one case. I listen to 100 cases already,
wow.
but I don't want to waste their money. I say you rather go to the regular doctor. The insurance doctor gave prescription because I
Right.
cannot help them. Because I cannot help them. Why I see them? Because they
Right.
don't want to make some things. It's not my philosophy. My job is 30%. Their job 70%. But that 70% their job is they don't want to do anything. How can I help? I cannot help them. That's
Right.
why some people they say why I cannot help them because you're not ready to want to make change yet. And some people wait until 10 years later they come back and they say I'm ready now. They get with their job and they time to ready to work with me. They can make some change because before why they don't have time because they don't have even 1 hour for themselves because they work for a big company, big CEO. They make $50 million a year.
Waiting 10 years to get treatment. I mean, what isn't
Yeah,
there a lot of
yeah,
damage done already?
yeah,
10
yeah,
years?
yeah. 10 years. Some people still alive. Some people not alive.
Oh my gosh.
Because you're strong,
Yeah.
they last longer. If you're strong like superpower, you last longer.
Right. So, Dr. Wu, when you were explaining about the blood being sticky versus fluid, that's what's going on in hypertension. Can you share a bit more about the yin and yang deficiencies? What is happening in the body in regards to the yin and yang energies?
Yeah, usually the young energy high is the body have too much carbohydrates. They eat too much meat. The young energy is too strong, but at the same time, they are strong energy. That's why they eat too much. Like they are tiger, eat too much meat and drink milk. And the black is like this, sticky,
Yeah,
look, like
right,
honey.
right.
And hard to like
Sticky.
hard, difficult. Yep, that's why blood pressure go up. And that's called excessive type of blood pressure. High blood pressure. That means they have too much young energy too. At the
Got
same time,
it.
too much young energy. And another type of high blood pressure is somebody very old age. Their chi, the spleen, and the spleen and the kidney young energy deficiency. They like horsepower is weak. You need to
Mm.
touch the horsepower because they are vegan too, vegetarian. They not eat cheese or they not eat meat. They still their artery is like clean. If they're
Right.
not, but they still high blood pressure because they they their body is weak. Their horsepower is weak because chi it can deliver the blood flow, and when your chi run low, your horsepower is weak, and you have to push harder. That's why blood pressure go up. That case, you have to charge the battery,
How do you
like
recharge the battery?
tonify the kidney energy, tonify the spleen energy, The young energy run low. That means like your body, like the bioelectric system, the battery run low in TCM. That's called spleen and kidney yang deficiency.
Right. Wow, it's very fascinating. I mean, so it's about balancing whichever energy you're deficient in. That's amazing. I think the audience will really appreciate learning about that. We're
But
coming,
a problem, the weak type, you need a TCM doctor to figure out if
right,
your kidney and spleen is yang deficiency. You need Chinese formula treatment.
right.
But type of problem is more like not. I say 90% of patients they can do it themselves. Just change their diet and reduce stress. They don't. It's easy. This type is easy, but 90%. If I can get 90% of the patient done, just make some change. I don't have to see them. I don't have to give them
Most,
early either. It's
yeah,
just need it's like that need they have to make some change. But only small percentage of patient need something. You have to figure
right.
out what's problem.
Yeah. Dr. Wu, you're the opposite of Western medicine doctors. You say, I don't really need to see the patient. Most Western medicine doctors want to see the patients, and you're the opposite. You say
Because
you
we
don't
go
want
focus
to, you don't want to see them.
because they focus on a lifestyle change.
Right. No, no. Yeah. No, I understand that. It's just really interesting, the cultural differences of that and your approach. Dr. Wu, we're coming to a close to the interview. Do you have a message for the world out there about high blood pressure?
That means they everyone should be look at what is more important.
Yeah.
It's number one. But there are a lot of people they grow up in the modern society. They training application training be too much attached to their career, too much to their job or corporate job. They put that 100%
Yes.
into their job. They is more important in their life. It's not make sense. That means people should be high blood pressure already. That means one of my student you're gonna interview him with Nathan, same thing. I asked him is what's more important. That's why he's looking for something out. That means they have high blood pressure. Be look at what they can change first.
Right.
Before, lifetime take the drug. If lifetime take the drug, it's difficult to get up because the body going addicted to the drug, and the drug only treat the symptom after a couple of years. Then they need more drug.
Right.
Does
Right.
not old drug no more work. They need to get them more heavy duty drug to
Yeah.
press when the pressure down, but high blood pressure down. In long run is damage their kidney too. Then become the dialysis. And
Right.
people should look at themselves early. Don't wait until too late. It's too
Right.
late. It's even it's difficult. It's
Right.
not, but early stage is easier to do something themselves.
Right. Right.
People to be look at what is more important for their life, but because people they don't know what is more important. Then who am I is number one important question. Then I recommend everyone should be have a person look at my movie. The movie get them the power. That
Who am
means
I? The
who am
documentary.
I,
Right.
who you are, and what you need. What is more important for you instead of everything for someone else. You have to take care of yourself before take
Right.
care of someone else.
Right.
I mean, who am I? Is number one important question. That's a message for the whole society.
Right. Well, thank you so much, Dr. Wu. And you heard it from Dr. Wu himself. So make sure you got your life priorities taken care of. Thanks so much. We'll leave the details in the caption. Thank you, Dr.
Right.
Wu.
You're welcome.